Ladies and gentlemen, I will be brief. Let me begin by heartfully thanking all of you for the great work that all of you do every day. Because I think the magic of keeping so many people alive, of consistently being available to solve, to save, to cure, to care, to counsel, and to innovate and keep educating yourselves on the future. For all this and many more things, let me begin by thanking all the cardiologists across this room and across the country and the world for your participation. I always feel at any conference like this that the medical profession is very special in their very generous sharing of knowledge. Every other science, every other industry first will patent and then hide their trade secrets. And when the medicine or when doctors do something special, the first thing they want to do is publish or talk about it at a conference. And it is that spirit which I think embodies the fact that you continue to make the world a better place. I want to also especially congratulate the organization. I think the ACVS India and South Asia 2022 is the outcome of over 13 years of collaboration between the FACS Foundation and Apollo Hospitals and the Cardiovascular Research Foundation USA. Over 1,000 plus interventional cardiologists over the past few years have exchanged thoughts, shared ideas, and helped each other in the most collegial manner. Live demonstrations like you've spoken about, sharing of ideas, each one of these have contributed towards making India a significant player in the global cardiac space. And let me in the same breath say that there is so much more to be done. Because we still have people dying every day of cardiac needs. There is the clinical aspect that all of you are doing an amazing job. There's the partnership in medicine and devices, and you have all your vendors on the other side. There's also the ecosystem. How about insurance coverage? What is the national ambulance policy? How can we bring ambulances on the highways? Because if you get a patient into the hospital fast enough, you will find a way to save him. But if he comes in too late, what are you going to do? In fact, a young child commented that you can watch the movement of a pizza on Swiggy and on your phone, but we're not able to see that for an ambulance and when it will be delivered. So I think the relative importance given to life versus all the other things is something that we must change. And Dr. Pratap said I should spend time in educating industry and the country on the importance of TAVI and TAVR. Let me say, Doctor, that not only was Apollo among the first to perform these procedures in the country, but we have across the country covered over 500 procedures. I think the Hyderabad team has done over 100. But what is more important is that we in parallel worked with the sector to make insurance start giving some coverage so that everybody else can get the reimbursement and the procedure can grow. And we have done this time and time again whenever we found that a procedure is clinically viable, is good for the customer or the patient, and will enable them to have a better quality of life. So this has really been the kind of backup we're trying to do. I look forward to a future where the new procedures, whether it is TAVI-TAVR, it's robotic heart surgery, again, you know, the typical thing as cardiologists become more invasive and the cardiac surgeons are becoming minimally invasive, and this merger is ultimately giving us a better treatment modality for our patients. But in the same breath, Apollo Hospitals is also working to make sure that we find our patients before that very first vessel is blocked. So AI-enabled risk models, education and prevention models, a series of things under the heading of pro-health will help to keep people healthier and happier so that we approach this from two sides, from the high-end treatment side as well as from the preventive care side. And so I want to also end by congratulating all of you, those of you who participated in the global pandemic and the tremendous call that it put upon us to bring innovation and courage and treat patients and find ways. So congratulations to everybody who has fought a good fight against COVID. But for cardiology, I think the fight is not over because the incidence of cardiovascular disease is estimated to have grown over 24% as an outcome of those who have had COVID, and therefore I would urge everybody to continue to enhance your capability. I would congratulate all of you. I thank our international speakers for your kind sharing of time and for physically being here as well. And of course to all our participants, all the best. India will remain among the evolving nations in terms of the most cost-effective quality healthcare, and we hope will continue also to play a role in the global healthcare space. Thank you very much. Namaste, and a very special congratulations, Dr. Srinivas, for all the great work that you have done, and to all your colleagues who have helped you make this happen. Thank you. Namaste.
Thank you, madam, for your great words of advice. And what we are at Apollo, not only treating high-end disease,